Can I come in?
Sure.
Hi, my name is Lynn. I'm one of the nurses. I'm getting ready to discharge you, but before that, we're going to go over some safety information about seizures.
Okay.
Because we were recently admitted to the hospital for an overnight stay because we just recently had a seizure and we don't know why. So first, I'm going to play a video and then we'll go from there.
Okay, thank you.
I'm here today to talk a little bit about how to perform basic first aid for a person having a seizure. Hopefully we've called 911 as soon as we realized someone was having a seizure. However, what you can do while you're waiting for EMS professionals to arrive is a couple things. Number one, make sure the patient's not going to hurt themselves any further. If there's furniture around, chairs, tables, things like that, we can move those away from the patient, especially if it's a full body shaking type seizure activity. If you have something soft, such as a towel, a blanket, a coat, and while they're seizing, if you can gently put it under their head so their head's not hitting the ground too hard, again, that's going to help prevent any secondary injuries during the seizure activity. We need to make sure that we don't lift the head too high because we can close off the airway when we do that. Once the patient stops the actual seizure activity, we need to make sure the patient's breathing. Hopefully you've had a CPR class. If not, I would definitely recommend you go get certified in basic CPR. And once the seizure activity stops, you want to take and you want to make sure the patient begins to breathe, because oftentimes when someone's seizing, they're not breathing at that time. But hopefully when the seizure ends, they will start breathing on their own. If they don't, we need to assist them by breathing for them, which is another topic altogether. What we're going to do is once they've stopped, we want to go and keep them warm, cover them up with a blanket or sheet, try to give them as much privacy as possible, especially if we're in a public area. Continue to monitor their breathing as we go. Again, wait for EMS, verify that someone has called 911. And for seizure activity, if it starts again, we just want to make sure we back up and don't allow anyone to get in the way or any objects to hit the patient or the patient to hit any objects. One thing you want to be careful of is putting something in their mouth. It used to be that you could put a bite stick or something in there. However, there's a great chance that they could actually swallow that or get it stuck in their airway and make them stop breathing, cause an airway obstruction. So make sure we don't put anything in the mouth during that time at all. If someone wants to do that, again, just recommend they don't, because oftentimes if they relax their jaw, that bite stick or other object will fall in there in the back of the throat, and then we'll have a whole other problem that's quite a bit more challenging to take care of. And this has been basic first aid for treatment of a seizure.
Okay, so how did everyone feel about that video? It was pretty informative, right?
I think so.
Okay, so let me get one thing. Okay, so first off, it's most important to make sure that she has a safe airway. Okay, so if for some reason she starts to have another seizure, we're going to make sure that she's to a safe place on the floor, okay, and not around any other objects, okay? Because if we're actively having a seizure and we're moving around, we don't want to hurt any other part of our body while we're doing it, okay? Also, we're going to call 911 because we need to get help as soon as we can.
Okay.
But then we're going to continue to make her safe.
Okay.
So Dad, I'm going to have you, so with a towel or something soft, you can put it under her head. If she is laying on the floor, I'm not going to have you get on the floor in the hospital right now, but we will
Like that?
explain that, yes.
Just a little pad under the head?
Yes.
Okay.
And we want to make sure that she has an airway, that she's breathing, okay? We want to make sure that if possible, we can tilt her chin up a little bit like this because that will open the airway.
Okay.
If for some reason she has anything in her mouth, if she's vomiting or anything like that, we want to make sure that we're going to put her on her side so she's not laying straight like this, because we don't want her choking on anything that's in her mouth. But we also don't want to put anything in her mouth at that time either.
Cool.
Okay? So after all that, we're safe. Hopefully EMS will be there by then. Once you follow up with your specialist and they give you any kind of medications, if they explain to you how to administer the medications, then you can do that at that time. But we're going to get you set up with neurology, and then they're going to handle your care from there.
Cool.
Okay? So I'll get your discharge paperwork and then we'll get you out of here. Any other questions?
Can't think of any.
Okay,
You
alright.
You answered them all. Thank you.
Alright, I do have pamphlets and handouts for you that'll go over everything that we just discussed. So there'll be pictures in there,
Perfect.
links to websites that you can go to that'll explain more in depth. But just continue to jot down any questions that you may have, so when you go follow up with your specialist, they'll be able to answer those.
Cool.
Alright?
All right.
Okay, I'll get the paperwork going.
Thank you.
Mm-hmm.